Hi, I'm Dr. Meghan Hodges, and I'm here to talk with you about TMJ today. In our practice, we treat a lot of TMJ patients. We have patients that come in for issues with headache, jaw pain, locked jaw, neck pain, back pain, a variety of issues. And there are a couple of different ways that we treat TMJ. The first one is that we use Botox. We insert that medication into the facial muscles to help relax everything and to get some pain relief. We also have an appliance, it's called an orthotic, and what it does is it helps realign the muscles into a healthy place where the jaw is resting back into a place where the muscles are balanced, where you can function better and feel better. We utilize TENS therapy to help relax the muscles, increase blood supply, and to help with healing along with our orthotic care. We also will go in and utilize scans to make sure that the muscles are in the right place and that we're keeping everything balanced. At our practice, every TMJ case is different. So whenever a patient comes in for TMJ care, we know that we're going to need to build their care around what's happening with their function, their muscle activity, and their bite, because we want to make sure that we're caring for TMJ in the correct way. Relief for TMJ symptoms is more about taking care of function than it is only about relieving pain. Oftentimes for patients, we will see that after we relieve their TMJ problem, they're also sleeping better, they're thinking clearer, and they're finally feeling back to themselves again.